I just want to say good morning, and I want to thank you all for attending this press conference. My name's Pat McGinnis, and I'm the Executive Director of California Advocates for Nursing Home Reform. We called this press conference to discuss the governor's proposed budget cuts and to discuss the catastrophic isolation of our elders in nursing homes and assisted living facilities. We have some wonderful experts who can discuss the we can discuss the potential impact of the proposed cuts. And we also have with us a family member who will talk about the inability to visit her critically ill relative. We have Claire Ramsey, who's a senior staff attorney with Justice and Aging, Elizabeth Zurcher, who's a managing attorney of Disability Rights California, Shauna Reeves, the director of elder abuse prevention at the Institute on Aging, Linda Nye, the policy advocate for Western Center on Law and Poverty, and Raquel Rivera, who's a family member advocate at the CPMC Davies campus. I just want to start, I'm going to just give a brief intro. I was struck by, I remember Mahatma Gandhi once said, I don't remember personally, but I've read this, that the true measure of any society can be found in how it treats its most vulnerable members. I think the COVID-19 epidemic has certainly exposed the true measure in California and around the country of how we treat our most vulnerable members. We're 35 to 40% of the people who have died around the country and in California from the coronavirus are attributed to nursing homes and assisted living facilities. And yet, while infections and deaths in nursing homes are increasing every day, the governor's proposed budget would eliminate or reduce the very programs that enable our elders and persons with disabilities to stay at home and out of nursing homes. It appears that by these budget cuts, what we are doing is forcing more people, more vulnerable, into nursing homes. Not only are we condemning our most vulnerable members to living in substandard, understaffed nursing homes, but we are condemning them to die alone in forced isolation from family members, friends, and loved ones, causing more physical and mental declines and even deaths. We've seen that every single day since this epidemic began. We will discuss these and other proposals that will have a devastating impact on our most vulnerable, including the proposed reinstatement of the Medi-Cal recovery rules that enable the state of California to take away the family homes of low-income deceased Medi-Cal beneficiaries whose only sin was being too poor to pay for private health care. So with this press conference, we are calling on our state legislators and our governor to reject these budget cuts and to allow at least limited visitation for our most vulnerable isolated elders. Sacrificing elders and persons with disabilities by forcing them into nursing homes, letting them become ill and die alone, and then taking away their homes is no way to run a civilized society. With this, I'll turn it over to our experts and we'll have time for questions after each has an opportunity to speak. I'm going to introduce Claire Ramsey, who's a senior staff attorney with Justice and Aging. Claire?
Yeah, thanks, Pat. And thanks everyone who joined today. I'm going to be speaking about the in-home supportive services proposed cuts. I just first though want to appreciate that great introduction by Pat and give one other statistic that I just think really frames this whole issue. There was data just released that 76% of the deaths in California are from older adults 65 and older. So that's over 2,500 individuals who have passed away in California because of COVID who are older adults. And as we've seen, older adults and people with disabilities are most at risk of all the severe consequences from COVID, including contracting it, hospitalization, and dying because of the disease. So I think all the advocates were pretty shocked when that reality was pushed against the reality of the governor's May revision, which basically proposes severe and devastating cuts to the very programs that keep older adults and people with disabilities living safely in their home. And IHSS, for context, is the biggest of those programs. It serves more than 625,000 Californians and employs more than 500,000 people. And it basically, for those of you not familiar with the program, pays people to work in individuals' homes so that they can receive the personal care and other services they need so they can remain safely in their home. And so, as you can imagine, in regular times, this is a vital service. This keeps people out of hospitals, out of nursing homes, keeps them from being injured and getting ill. But during COVID, it just feels unconscionable and irresponsible to be cutting programs that are keeping people safe. The major IHSS proposal in the budget is a reinstatement of a 7% across the board hours cut to every single IHSS recipient, regardless of how severe their need is for services or how severe their disability and functional limitations are. This is a cut that had initially taken place in the early teens, but since July 1st of 2015 had always been fully restored in the last several budgets. But because they never formally repealed the statutory language to put in place these cuts, the governor has proposed to basically allow those cuts to go back into effect effective January 1st of 2021. For some context, what we're worried about is 7% represents real hours of service to all these individuals. People get a variety of services. So when you are cut by 7%, you make choices, and those choices are only bad. So you might be choosing between getting bathed and groomed and having someone get your groceries. You might be choosing between having someone be able to prepare a meal for you or getting out of bed. And these are serious, dangerous things to force people to live without. People are only given the hours that they are approved by their county for, that they actually need. So basically we're saying that we don't care what people need. We are going to reduce them by 7% regardless. It also means that most of their caregivers will not get other jobs. They will just simply take a 7% pay cut. And these are almost all low income working women, mostly women of color. And most of the IHSS participants, over 65% of them, are also people of color and low income. So this is devastating communities that are already the hardest hit by the COVID epidemic. So we're just imagining huge ripple effects. There is an absolute need to keep people out of hospitals and nursing homes right now. And we are extremely scared that this 7% cut will have no other effect but then to require that people, in order to stay safe, must go into higher levels of care, must risk their health by going to hospitals or nursing homes. And we anticipate seeing sickness and death because of these cuts. So we are in opposition to all these cuts, but really both from a moral standpoint and from the sense that there is no way that this is going to reduce costs to the state, because putting people into hospitals and nursing homes is way more expensive than keeping them safely at home. There are a couple other IHSS cuts, but they are significant, but they are not as concerning as this huge 7% cut. So if people later have questions about those other cuts, I can speak to them, but they're more administrative than they are direct program hours. And with that, I will turn it over back to Pat. Pat, you're muted.
To Elizabeth Zurcher, who's the managing attorney for Disability Rights California.
Thank you, Pat. Thanks, Claire, and hello, everybody. I just appreciate CANHR's organization of this press conference on these really critical issues. We, along with our partners here, oppose the cuts that are proposed in the May revise that will harm seniors and people with disabilities. And there are many of them. I'm going to focus on CBAS today, but we do have a position statement on our website that I can share if people are interested that goes through the various cuts. So I want to talk about the life-threatening harm to seniors and people with disabilities, which is going to result from the elimination of the CBAS program. CBAS is community-based adult services. It's a Medi-Cal funded program which provides adult day health care in the form of nursing, social work, meals, physical therapies, and other services which keep people with disabilities and seniors in their own homes. And for those of you not very familiar with the program, it serves approximately 36,000 people, 35,000 of whom receive Medi-Cal. People in the program are individuals with Alzheimer's, other cognitive disabilities, and significant health issues, heart disease, hypertension, diabetes, cancer, Parkinson's disease. Most people require care and supervision by their family members and other caregivers around the clock. CBAS is a lifeline to these participants, and there's 73,000 caregiving family members. Another important point is, in order to get these services in the first place, a doctor has to certify that without them, you would have to go to an institutional placement like a nursing facility. So during the COVID-19 pandemic, CBAS has been an essential component of the system, keeping seniors and people with disabilities safe at home. CBAS providers have worked to support their participants and their families, and have been in coalition with the Department of Aging, Department of Public Health, Department of Healthcare Services, and have conducted more than 324,000 COVID-19 wellness check-ins and assessments, 972,000 related interventions, and in-depth services to ensure that these vulnerable seniors and people with disabilities remain safe. So, it's particularly shocking that this program is now slated for elimination in these times. And it's a shock that's heightened by the tragic numbers of deaths in nursing homes in California right now due to COVID-19. Without CBAS services, the 36,000 people who are in this program face institutionalization and really terrible risks that are going to come with that. I'll say, the risk of institutionalization is heightened now by COVID-19, but in 2009 through 2011, the state attempted to cut this program before, and we and our partners, Justice and Aging, National Health Law Program, AARP, challenged those cuts and reductions as a violation of the ADA, and the Supreme Court's Olmstead decision, which holds that unnecessary institutionalization of people with disabilities is a violation of the ADA's integration mandate. And those challenges were successful. So there's a tremendous amount of precedent for why this kind of cut should not happen, both morally and legally. And finally, I'll just say that, California has been a leader in the move to shelter in place and protect its citizens. And this really flies in the face of that leadership. It's undermining the tremendous effort to limit the spread of COVID-19, which California has undertaken. And, frankly, eliminating this is not a tolerable solution. So thank you. And as Claire mentioned, and Pat too, Claire and I both have to get off, but we can happy to be available at another time if people have further questions that we don't get to today.
And other speakers, do you mind if we send out your email addresses to the media so that they want to have follow-up questions? Is that all right?
Yes.
Please feel free. And we both can stay on for a little while longer, but.
Okay, because we'll be done. I want to introduce, just to note, the governor's proposed budget would completely eliminate the CBAS programs, completely eliminate the, I'm sorry, I'm just losing my train of thought, the other programs that would ensure that people can be able to stay at home with the support they need. I'm going to introduce Shauna Reeves. She's the Director of Elder Abuse Prevention at the Institute on Aging. Shauna?
Thanks, Pat. So I knew that we were going to touch on similar themes. I feel like I'm really going to be touching on the same themes that Pat, Elizabeth, and Claire touched on. So I'm going to talk about the Mssp program specifically, and I'm speaking from my heart on this. My first job out of social work school is with that program. I also worked at a CBAS. So hearing that these two vital programs could be eliminated was quite a punch to the gut, if not stab in the heart. The Mssp program in California serves 11,000 clients. In San Francisco, we have 530 clients, 38 sites throughout the state. A number that I'd like to let you guys know about, because it's strikingly different than what we're seeing in nursing homes, that of those 11,000 clients in Mssp programs throughout the state, only 15 have tested positive for COVID-19 and 3 have died. So again, compare that with what's going on in nursing homes. The Mssp program was conceived to help elders stay in their homes and their chosen communities with supports, with help coordinating with healthcare professionals, with help coordinating their transportation, getting their medications to them, linking them to community benefits, making sure their house is safe to them through things like home modifications. These are all things that do exactly what the governor has been telling elders to do. Stay at home, stay safe. It's also keeping elders out of nursing homes. Again, this is the theme that you've been hearing already. Additionally, these programs keep elders safe from abuse. So I went from working in MSSP and also a CBAS, okay, my apologies, to working in elder abuse prevention, where I see what happens when elders don't have those supports that they need. What is the purpose of these cuts? To save $410 million over a 2-year period, the math doesn't add up. If just 18% of MSSP clients end up in a nursing home, all of those savings go poof. What happens to those 36,000 frail seniors in CVAS sites? What happens when their support goes away? Will they end up on the street? Will they end up in nursing homes? All this is possible. That's why we need to keep these. It's why we need to keep these programs running, and it's why I'm so proud to be in solidarity with all of you to make that happen. I'm going to give back to Pat so that my 2-year-old can calm down a little bit. Thank you.
Thank you, Shauna. And I want to turn it over to Linda Nye, who is an advocate policy advocate for Western Center on Law and Poverty. And they also co-sponsored the wonderful Medi-Cal recovery amendments that we got passed in 2016. And they have been a major advocate in Sacramento for many of the programs that, in fact, the governor is proposing to cut. Linda?
Thanks, Pat. Linda Way again with Western Center on Law and Poverty. The May revision proposes to reinstate harmful Medi-Cal estate recovery policies that take the home of poor families, primarily homes owned by Black, Latinx, and API families. Beginning in 2017 and following advocacy from CANHR and Western Center, the state limited estate recovery to long-term services. Currently, once a Medi-Cal beneficiary dies, the state can only recover the deceased assets for nursing home care that Medi-Cal paid for after the age of 55. But the governor is proposing to go beyond the federal requirement and recover for all Medi-Cal services paid, including the payment made every month to Medi-Cal plans, even when no health services were used. Because most people are enrolled in a Medi-Cal plan, where the state pays a monthly premium, clients often refer to the expanded estate recovery policy as a lien against their home. Western Center originally worked on limiting estate recovery because we heard many stories of older adults refusing to enroll in Medi-Cal or even disenrolling for fear the state will put a lien on the family home when they die. The last thing we need during a pandemic is a punitive rule that will cause older Californians to go without care and which exacerbates the racial disparities in intergenerational wealth transfers, as this targets the modest homes of poor communities of color. At a time when the governor is proposing to roll back eligibility expansions that serve seniors, including ending the senior penalty so that seniors continue to be subject to a lower income eligibility than other adults, and cutting benefits that our elders rely on, this threat to recover grandma or grandpa's home beyond what is federally required is cruel and increases homelessness for multi-generation families who live together. Thanks.
Thank you, Linda. I will say, in terms of Medi-Cal recovery, we do have a couple of fact sheets and would be happy to, we'll post them on our, or if you email us, we'll be happy to send them to you. The last speaker is Raquel Rivera, and I want to say, one of the biggest problems we have right now in nursing homes is the forced isolation of elders, people who are seriously ill, people who get the COVID, people who die without seeing their family members for a last time. And I just want to say, if we can allow staff to go in and out of facilities where we know that they are the major problems with nursing homes because everybody's isolated in an assisted living facility, we could certainly allow a designated visitor. And that's, I'm going to introduce Raquel, and she can talk about trying to visit her relative. Raquel?
Good morning. First, thank you so much for this virtual conference. My name is Raquel Rivera, and I'm here with my sister Gloria. Our sister Sandy is a patient at Sutter Health CPMC Davies Campus Subacute Unit. She is currently hospitalized in TICU at CPMC Davies Campus, unrelated to COVID-19.
Oh, there it is. I see it.
We are here today because of the current policy of no visitors allowed in the unit my sister is going to be transferred to, which is the subacute unit at Davies Campus. We understand that there is an ongoing pandemic and that we need to take precautions to keep everyone safe. However, at what point will patients be allowed to have visitors again? This is why we are here and pleading with CPMC to work with us and allow us to take the same safety precautions and follow the same safety protocols as their hospital staff, and just allow one designated family support person as a visitor. We are asking this because visitors are also part of a healthy social lifestyle for patients. We are social creatures, and in-person contact is essential because isolation can negatively affect mental and physical health. The California Department of Public Health All Facilities Letter 20-38.1 recently issued guidelines for all healthcare facilities to allow limited visitor access by a designated support person under certain exceptions. However, CPMC has chosen to follow their own interpretation of these guidelines to exclude visitor access for its subacute or long-term care. Visitation by a designated support person who is following all safety protocols and precautions should be allowed in all healthcare facilities, including long-term care and subacute. And it needs to be mandated so that it is universal and not open to interpretation. As Governor Newsom stated in his briefings, we're not going back to normal. It's a new normal with adaptations and modifications. And we agree, there needs to be a new normal that allows visitation in all healthcare facilities, but doing so in a safe manner. Thank you.
I keep forgetting to unmute too. Thank you, Raquel. I think that is the crux of what we're asking today. We want the legislator and we want the governor to reject these cuts. All we're doing is condemning elders and persons with disabilities into nursing homes by taking away the only safety nets that we have to be able to, for them to remain at home. We are also, for $16.9 million, which is the price tag put on the Medi-Cal recovery, which is not really a savings and it's not a budget cut. In fact, that's what they estimate that they're going to be able to get from the homes of poor, deceased Medi-Cal beneficiaries. So we're going to be destabilizing low-income communities. We're going to be forcing ill elders and disabled persons into nursing homes, and we're going to be denying visitors to those who are in nursing homes and assisted living facilities, and forcing isolation, which only increases the morbidity and mortality of these residents. And that, in essence, is why we called this press conference, and I'll open it up to questions now. Okay. We do have fact sheets on all of this, and we do have email addresses for everyone. Does anyone have any questions?
What would you say people could do to try to influence the legislature on this?
Well, the problem is that the budget has to be passed by June 15th. And right now, I think there's an Assembly Budget Committee hearing tomorrow. And I think that there's a Senate Budget Committee hearing on, is it Saturday? Does anybody know? I think it is Saturday. Linda?
It's Sunday.
Sunday. Okay. So we've got to get letters in to our legislators. We've got to tell them to reject these cuts, and we've got to also press the governor to allow a designated visitor for these ill and disabled residents. Linda, do you want to add something?
Yeah, I would say the target would be both the legislature and the administration, since even though what the governor proposed in his May revision is it's bad, and there's a limited opportunity with the timing to push. But both the legislature and the governor will be making decisions on what to cut and what to keep, and a lot of it relies on federal advocacy. But at the same time, our deadline is June 15. We know federally they're not coming back until the Senate's not going to look until June, and so timing-wise, also if we need to push for some of these triggers that happen based on federal cuts to not cut those, if you're going to tie it to federal funds, and they're not going to make those decisions until later.
And the ultimate irony is that this budget revision also includes millions and millions of dollars to nursing homes, the very places where these people are dying, which is ironic. Iris, do you have a question?
Yeah, I do. I'm Iris Neal with East County Magazine, and I talked to Mike previously. I was just wondering, did Governor Newsom ever sign that request to release liability from the nursing homes?
Not yet. He hasn't released an emergency order as yet.
So he hasn't
No.
signed the request that they put out yet. Okay.
No, and I think it's going to be somewhat limited, but we'll see. We're waiting. We've had a lot of folks pressing the governor to not do that. Let's face it, many of these nursing homes in California and around the country were understaffed, substandard, had multiple deficiencies for infection control and prevention even before this. So now, after all these people have died, after so many people have become infected, after they didn't provide proper PPE to their healthcare staff, so now they want immunity from everything, which is, and now we're going to give them millions and millions and millions of dollars in more money with no accountability. So ain't that great?
Awful. Okay.
Anyway.
Can I ask a question?
Yeah, absolutely.
I'm Wayne Chen with the Sacramento Bee. The IHSS hours, I know that they vary quite a lot depending on the individual, but do you have an average for how many, like what the average hours are for a person to receive maybe in a month, so we can get a sense of what a 7% reduction like represents?
Yeah, this is Claire, and Elizabeth does a ton of work on IHSS too. So my memory is that average hours per month are around 100 or a little over. But as you mentioned, it really varies, and the people with high needs can get as many as 283 a month. And so it can represent, sort of in the 7-hour actual range up to like more than 20 hours a month, less hours for a person.
Okay, thank you.
And I'll just add, I would add one thing, this is Elizabeth Zurcher, to what Claire said, which is that the max is 283. That doesn't mean that people magically only need 283 hours per month, but that's, for various reasons, that is the maximum number of hours. So many people need far more hours than the 283. So the 7% is reducing from an unmet need already, if that makes sense.
And just really quickly, on visitation, the California Department of Public Health has left a little room for a visitor who is delivering essential health services to be able to get access to a resident. So far, it's our experience that facilities are not respecting that guidance. So if anybody out there knows of a family who's delivering vital health care to a resident of a skilled nursing facility, let us know, because that's something we would be interested in helping you out with.
That's what Raquel was saying, is that, she's aware of the all facilities letter and the department's position on this. CMS was put out guidelines for the states that said that, if you didn't have a COVID positive person with it for 28 days. So we're supposed to allow people to remain isolated in nursing homes where people are dying, where people are sick, for another 28 days. And also, as long as the facility with the as long as the facility met the staffing requirements, whatever those might be. They've never met the staffing requirements. They haven't met them in California. They haven't met them around the country. But I think that having a designated visitor and having somebody who's crucial to provide their support, the emotional support, and oftentimes the physical support that these people need is absolutely essential. Raquel, you have anything to add?
Yes, hi, Raquel here. Yes, I just like to add that we're in that situation right now with our sister who is developmentally disabled and falls under those guidelines in that AFL 20-38.1. And CPMC is choosing to ignore that letter, saying it does not apply to the subacute unit.
Thanks for that, Raquel. That's something I'd be interested in talking to you about afterwards.
Thank you very much.
Other questions? We do have fact sheets on all of these issues. We do have email addresses for the speakers today, and you can email any of us and we will follow up with you for any other questions. Linda, did you have anything?
I had one more. So Pat, is there, so what has been decided about visitation? Has there been any new standards put in place for visitation?
Well, yeah, as Raquel was saying, the Department of Public Health released an all facilities letter saying that you could have somebody who provides the kind of physical support, et cetera, for these nursing homes. The problem is the nursing homes aren't following it. They're saying, no, you can't come in. No, we're not going to let any essential visitors in. And they are essential visitors. We allow nurses' aides to go in and out of facilities, to work at more than one facility, to go into a facility. Where do you think the COVID is coming from? These people have been isolated. So we have nurses' aides coming in and out of facilities, spreading the virus, and we won't let somebody, as long as they take the safety measures that other facilities and that they're requiring of essential personnel in those facilities, why would we not allow somebody to come in?
Right.
Brenda, did you have a question?
Yes, I was wondering if Raquel could speak to how this is affecting her sister, her developmentally disabled sister, and the emotional toll that it's taking on her, and as well as yourself.
Excuse me, could you repeat the question? I have my sister Gloria here, who's also been involved with their care.
Hi, okay. Gloria.
Hi. Yes, I was just asking if you can talk a little bit about the emotional toll this is taking on your developmentally disabled sister, as well as the toll it's taking on yourselves.
It's taking a very hard toll on myself too. My sister is mentally challenged, and right now she had suffered a brain damage, and right now they're stating that that there's no help for Sandy. But little do they know my sister, she's a strong Rivera, and I go in there. They're allowing me an exception just because she's in TICU. That's the only reason. I go there once a day for around 40 minutes, and I speak to Sandy, and she opens her eyes when she sees me. It's very, very, very emotional for me because they're threatening me that if I don't move her to subacute, they're going to start billing us for her stay in TICU. And I'm pleading with them to please, it's essential that I see my sister in the subacute unit. You have no idea how important it is, for stimulation of her brain. And they're refusing it, and they're saying due to COVID, they're not allowing it, and it's just a big no. So that's why we're here today, hoping and pleading that I see my sister every day.
Raquel, they're letting you see her in the ICU, but then when they transfer her to the subacute, then they're saying no.
That's correct.
Yeah, that makes a lot of sense.
Yes, they said they cannot allow it due to COVID, and even showing them the guideline, the all facilities letter that I mentioned, the 2038.1, it does refer to all health facilities, but they said no, that it does not. So they're using their own interpretation and denying us the right to see her in subacute, even though we mentioned, taking all the safety precautions. And we're asking for only one designated support. So not all of us, at least the one person, Gloria, who has been going every day currently while she's in TICU. But they said the minute she's transferred, all visitation will stop.
Doesn't even make sense. Any other questions about the budget, proposed budget cuts, Medi-Cal recovery, visitation? I can tell you just from my own experience, since Governor Wilson put the original Medi-Cal recovery program, it's probably one of the most draconian ones in the whole country. The overwhelming majority of these Medi-Cal recovery claims were against low-income minority communities. The only thing that people have when they've been on Medi-Cal after they die is their home. They can only have $2,000 in assets in order to apply for Medi-Cal in the first place. So what people have when they die is a family home. And we have a lot of multi-generational communities living in the grandmother's home or the mother's home. So you get a Medi-Cal recovery, a state recovery claim, and you can't pay it, which most low-income people can't. You end up with an estate recovery claim, lien on your home. And the previous law charged 7% interest, which is a usurious rate in the first place. And that was changed as well with the law, with the new law that we got in with Western Center on Law and Poverty. Now, we want to go back to that, which is, again, it's just absolutely unconscionable that we would even think about doing that. When what's your crime? You're too poor to pay privately for health care. You don't put a claim on Medicare. Medicare, you could have a $500,000 heart surgery. There's no estate recovery claim. But if you're too poor and you have to go on the Medi-Cal program, watch out if you're 55 and older, which is just a disgusting, even the idea of it is disgusting. So,
Pat, how much does that change to the recovery policy save the state?
they're saying that they're going to have $16.9 million in savings, but it's not savings. They're going to have to spend millions of dollars to prime up the Medi-Cal recovery unit again. That'll be millions of dollars. Secondly, this is not savings. It's not a budget cut. It's estimated of how much are we going to get out of the homes of low-income communities. That's what it is. It's not a savings. And to pretend that is just, again, it's misleading. And it's a betrayal of all those people that we were telling, since 2017, January 1, don't worry about it. There's no recovery if you put your home in a trust. Don't worry about it if you do this or if you do that. So all these people, or surviving spouses, there's no recovery on surviving spouses or registered domestic partners if they own their home in joint tenancy or tenancy in common or however, community property. Now we're going to go back to that and tell them, sorry, we were just kidding. Now they're going to be able to take your house.
Well, and not only that, but when the house has to be sold or the individuals cannot pay off the loan, then they'll be forced to be homeless, and that's going to be another burden to the state. Where will they go? And what other state resources will they have to rely on in order to survive?
Yeah, at a time when housing and homelessness are supposedly top priorities, we're doing this. Linda, anything?
Yeah, that housing point was what I was going to make as well, as at a time when there is a real housing crisis to take away the homes of poor families, multi-generational families, is going to destabilize the community, but also increase homelessness.
If there's no other questions, hold for you. We would be happy to send out the emails of the speakers today so that if you want to do follow-up questions with them, Shauna, Linda, Raquel, that's okay with you?
Yes, that's
Okay.
fine.
All right.
Thank
Shauna,
you.
okay with you?
Sure.
Okay.
Thank you.
And I thank you very much for joining us today. And if you want any follow-up information on any of these issues, whether the proposed budget cuts, on Medi-Cal recovery, and on the visitation issue, we have a very good fact sheet on that as well. And I thank you very much. And I thank all of our speakers today. You're
Thank
precious,
you very much,
and we
Pat.
appreciate
Thank
it
you.
very much.
Yeah.
Deborah, did you have a question?
Oh, I just said thank you very much for doing
Oh,
this. It was very
okay.
helpful.
Thank you for
Okay.
joining us, Deborah.
Absolutely.
All right.
Thank you.
Bye.
Bye.